Good evening and welcome to Chicago Tonight. I'm Brandis Friedman. On the show tonight, COVID cases are rising across the country. An infectious disease doctor on that and more. Can Chicago public schools reopen safely? A look back at lessons learned from Chicago's deadly heat wave. A conversation on controversial team names. And should you call them Bison or Buffalo? That and other facts about the shaggy beast found in some Illinois parks. But first, some of today's top stories. Another violent weekend in Chicago. The city's top cop is already calling for the expansion of a community policing initiative launched just last week. Between 6 p.m. Friday and midnight Sunday, 11 people were killed and 53 others were wounded in 50 separate shooting incidents, according to the Chicago Police Department. 6 of the victims shot were children.
We're directing, as you may have seen on other stories, our summer mobile unit to grow and then transition into a citywide permanent unit at some point, but to do a community service project every day. Right now it's once a week. I want to do it every day in the community so that we are seen as a partner in the community, particularly in the west side, south side.
And you can read more about this weekend's violence at WTTW.com/news. The Illinois Department of Public Health is reporting more than 800 new confirmed cases of COVID-19 today, bringing the total number in the state to almost 155,000. That comes after several days last week and over the weekend that saw more than 1,000 daily cases. There were also 6 new virus-related deaths reported for a total of almost 7,200. The state is reporting a preliminary 7-day positivity rate of 3%. The 2020 Chicago Marathon is the latest city event to be canceled this year because of the COVID-19 pandemic. The annual October race usually draws tens of thousands of participants and well over 1 million spectators. Event organizers say the public health risks associated with such a large event made it impossible to continue this year. They're offering runners refunds or the chance to defer their entry payments to a future race. And Chicago is already beating records for the number of mail-in voting applications for the 2020 general election. The Chicago Board of Elections says more than 121,000 residents have applied online for mail-in ballots, beating out previous records set earlier this year during the March primaries. And in November 1944, that election, it was during World War II. Board of Elections officials say they plan to send out close to 1 million vote-by-mail applications in the coming weeks. And there's more of this story on our website, WTTW.com/news. The coronavirus pandemic may have pushed back the deadline for the census, but it's not any less a priority. Amanda Venicky joins us now with the latest. Amanda.
Yes, Brandis, the census was supposed to be over and done by just about a month from now, by mid-August. As you noted, COVID-19 not only pushed back that deadline, because now responses have to be submitted by the end of October, but the pandemic also complicated efforts for outreach. Today, the mayor put on a green Western-style hat to announce a novel approach to getting the word out. She says it's time to giddy up.
And I'm happy to report I'm calling out the Census Cowboy. So, if you see the Census Cowboy coming to your neighborhood, that's not a good thing. That means you got
Not a good thing, because the Census Cowboy will only be going to the Chicago neighborhoods with the lowest response rates, the 10 neighborhoods with the lowest response rates. The mayor's office says that the cowboy will be compensated for his efforts, though not by the city. They did not give any details on to who will be paying for that equine outreach effort. That cowboy, by the way, Adam Hollingsworth, he was featured on WTTW Chicago Tonight back in May as the dreadhead cowboy in our Chicago Portrait series, and you can find more on him in that on our website. But why we're going the horse route to grab attention is because Chicago's response rate to the census thus far is about 55% citywide. Some communities within the city are particularly hard to count and are designated as such, and often these are lower income communities. In Chicago, that often means communities with a high concentration of people of color.
Are more likely to be renters, which are also a hard to count group. So for a variety of reasons, I would say for reasons that have to do with attitudes toward the census of distrust and skepticism, and reasons that have to do with physical, logistical issues uh, that are made worse based on poverty and low income status.
Another issue for impoverished areas, gaps in access to the internet. Kareem Butler with the Chicago Urban League says because of COVID-19, the Urban League, though, has had to pivot from its traditional outreach plans and has actually done a lot online.
Even though internet access is a challenge in these communities, I think sometimes it can be overstated to the point that people sometimes diminish the importance of internet outreach. It's still an important piece, especially right now. It's really important since we can't have that face to face. So those live events that we've held, where we bring together, different leaders, public officials to speak on the census, streaming it through Facebook Live, doing different things like that, has been really important.
You can still fill out the census form by putting it in the mail or by calling a phone number, but for the first time, this census is completely available to everyone online. Now, despite all of that, the census is actually going back to a traditional tactic for increasing the response rate. Enumerators will be going door to households that have not yet completed their census forms. The census is hiring people for that job after Marilyn Sanders said a lot of people turned it down because of the coronavirus.
There has been challenges in terms of COVID-19 impacting the hiring. So at this particular point in time, we are in the process of selecting over 11,000, maybe closer to 14,000 people to go door to door. But it does depend on the response rate. What's equally important is that as individuals are hired and selected, they have to go through training and they have to go through assessment. They take COVID-19 training.
The census is taking precautions to COVID-19 per CDC guidelines, including these enumerators will all be provided with hand sanitizer. They also have to wear masks. But Alderman Ariel Reborges says if you don't want a stranger coming to your house during a pandemic, well, it doesn't have to happen.
Soon the enumerators will be going out knocking your doors. We can avoid this. We can avoid this by 5 to 7 minutes to fill out the census.
Before I toss it back to you, Brandis, a reminder on why all of this matters. It's because Illinois and its municipalities get money from the federal government based on population. So the more people that fill out and turn in those census forms, that means more funding and more services going back to these communities. And we'll be back in just a bit with a look at just how well certain communities in Illinois are doing. But for now, back to you.
Amanda, we'll see you in a bit. Thank you. And now to Carol Marine and the surge in COVID-19 cases across the country. Carol.
Brandis, COVID-19 numbers are rising nationally to startling new highs. Cases in Illinois and the city are also climbing. By any metric, the virus is winning, even as awareness of its dangers has increased. So what is going on? Joining us now with more, Dr. Emily Landon, Associate Professor of Medicine and the Executive Medical Director for Infection Prevention Control at the University of Chicago Medicine. Welcome back, Dr. Landon.
Thanks for having me.
1 in 100 people in this country are now infected, 1 in 25 in Los Angeles alone. There's no federal mask mandate, no nationally coordinated testing program. How are we going to unify people against this disease if they're not all in the same fight?
Well, I think we're doing it right now. People like you and I need to appeal to everyone. This is not something that we can trifle with. We really need to get on the same page. It's not a hoax. It's not just the flu. It's a real serious issue.
But to that point, we're not doing it right now. We're talking it, we're washing our hands. You and I are wearing a mask, but everyone is not even in my own neighborhood on the north side of Chicago. So what are we missing and what aren't they hearing?
I think it's really important to remember that a mask is just another piece of clothing. It's like gloves in the winter to protect your hands from the cold. It's just a piece of fabric that you put over your nose and mouth to protect you when you're out and about.
So why aren't they hearing the logic of that?
Well, I think some people are uncomfortable in their mask, which is true. I'm uncomfortable in the beginning of wearing a mask, especially when I was a new medical student having to wear one for extended periods of time in the hospital, but you get used to it. I think we need better, well, I'd like to say I think we need better national leadership. In Illinois, we're lucky to have really great politicians that are working together to try and keep us in a better situation than many of the other states are.
Schools and whether they should reopen. Parents are agonizing about this. LA has just pulled back on its reopening. San Diego. Would you send a child to school in Illinois in September if that school was open?
I don't think I can answer that question. Decisions about school need to be made based on the local epidemiology nearer the time of the start of school. Right now, it's probably okay, especially for the younger children, to be back at school. But depending on how things go in Illinois, that may be very different come September.
Governor Pritzker was on a call with other governors and the federal government recently, and he stressed messaging around testing for free. Let's listen to him for a moment.
We've got to make sure that everybody knows they can get a test for free, that they shouldn't be dissuaded from getting a test thinking this is going to cost them a lot of money. Hopefully you've got private coverage, but if you don't, let's make sure everybody can get a test, because that's the most important thing, along with contact tracing, that we can do going forward.
I see you nodding. You obviously agree. You obviously have agreed. So again, to the question, how can we accomplish that?
The lack of coordination in healthcare with the payment of healthcare that's been going on in our system for years and years. For now, the best thing to do is to cobble together some sort of plan that will make it so that people can get the tests that they need. Testing availability is better in Chicago than it is in many parts of the world, but that doesn't mean that everyone has access whenever they need a test.
Is there any way that epidemiologists like you can hold sway on that, or can create the plan that is executed on a national level?
I think right now asking for anything on a national level is kind of ambitious. But certainly in the state of Illinois, I've talked with the governor about this, and I've worked with the University of Chicago. We offer a lot of testing. We partner with a lot of community organizations to also offer testing, and many other hospitals in Chicago are doing the same. I'd like to see that happening across the country. We can work together to cobble together a great testing system, even without the national leadership that we all are really yearning for.
As we talked about a unified response, or the lack thereof, the president right now is at odds with the Centers for Disease Control, and as you know, today tweeted the words of a former Wheel of Fortune host that the CDC and everyone is lying. Dr. Landon, do you have faith in the CDC?
I think the CDC definitely made some missteps early on, but it's really hard to do everything perfectly in a pandemic. I trust the scientists at the CDC and the public health professionals who have been there for their whole careers and who have studied and worked hard to get there. The political appointees, I don't know what to say about. I don't have a lot of experience with them, but I trust the science that comes out of the CDC, and I really hope that their recommendations are not tainted by political persuasion.
Do you have faith in Dr. Fauci?
I do. I think Dr. Fauci is a great advocate for doing the best thing, and I'd really like to hear more of his voice.
So the state is in phase 4. People are out there on the Riverwalk. They're going to bars. They're going to museums. Have you been to a restaurant yourself?
No, I'm not ready to be eating inside. I have an immunocompromising condition and I'm at higher risk. And so many people are like me and may not want to be doing things that are higher risk right now. For me, higher risk, anything that requires me to take off my mask and be around other people or be inside. So eating at a restaurant, unless I'm eating outside, is out.
So, but you haven't been out on a patio in a restaurant in this pandemic?
No, not yet, actually, but I've been outside a lot. I've been to a lot of stores, and I've seen friends and added some people to my quarantine family, or the people that I'm willing to be up close and unmasked with. And we're going to visit my mom out in the suburbs next week. So I'm very excited about that.
How have you negotiated that? Like, what deal have you made with her about how close? Because you haven't seen her physically in this pandemic?
No, she was stuck in Florida, of all places, and came home 2 weeks ago on a plane. She followed all of my instructions and stayed quarantined at home for 2 weeks and did great, is not sick, and is feeling fine. And then she's really being careful about her contacts. And that's part of the reason that I'm being really careful about mine. I want to save up my contacts and my quarantine family for the people that matter the most to me. And that's my mom.
Well, we wish you a wonderful visit with your mother, and I know she'll have a wonderful visit herself. Dr. Emily Landon, thanks so much for being with us. Now, Brandis, we go back to you.
Carol, thank you. President Donald Trump and Education Secretary Betsy DeVos are pressuring schools to fully reopen in the fall. The president is also threatening to cut funding from school districts that don't fully reopen, although it's not quite clear how he could do that. But as many teachers, parents, and students express fears over returning to school, Chicago Public Schools has yet to unveil a specific plan as coronavirus cases surge across the country. Joining us now are Amy Court, Vice President for Policy at the Illinois Policy Institute, and Stacey Davis Gates, Vice President of the Chicago Teachers Union and Executive Vice President of the Illinois Federation of Teachers. Welcome back to Chicago Tonight, both of you. Thanks for joining us.
Thank you.
So, Stacey Davis Gates, let's start with you, please. Many medical experts say that sending children back to school at a time when cases are surging could create sort of a super spreader event leading to infections for children, teachers, parents. And of course, we've seen a rise even in our own state just in the last few days. You know, is it possible? Sorry, we're looking at a graphic right now. Those red bars are just the last 7 days, so it does show a bit of an increase here in Illinois. Stacey Davis Gates, is it possible to have in-person instruction safely under these conditions?
There's no way to reopen schools safely in the middle of a pandemic. We haven't even hit the second wave. Look, any school reopening plan is a plan that is only about mitigating risk, which means that there will still be harm. And that harm will come to the workers in the school community, it will come to the students in the school community, and it will come to their families. You know, we are just at a time where we need to center what safety really looks like and how we mitigate harm, but even more so, how do we create infrastructure to actually perform remote learning in a way in which is a benefit to the greatest amount of our students, especially those who need it the most.
Amy Court, President Donald Trump tweeted last week that he may cut funding for schools that don't fully reopen. But of course, as we just said, it's not clear how exactly he could do that. You know, is that appropriate or effective at this time to be pressuring schools during the middle of a pandemic?
Well, I think school reopening is very much a local decision. Chicago Public Schools decides whether schools in the city of Chicago reopen. It's not really a federal issue. It's mostly a state and local issue. And I think that, as Stacey said, you're talking about risks, but in our everyday lives, in all of life, we balance risk. And the risk of Chicago schools staying closed presents much greater problems for Chicago students than the health risks of COVID. We know that students are, by and large, in low-risk categories for both severe illness, and it's looking increasingly like children are at lower risk of transmitting the disease. But we know that the risks to kids of not going to school, of missing out on their education, the risks to their mental health and emotional health and physical health is great, and it's increasing, and they can't afford unnecessary loss of education. And we can also mitigate risks, as Stacey said. It is about mitigating risk, and we can protect teachers and communities, and we can protect high-risk kids and the high-risk members of their families from this, and also educate most students in person.
Now, Education Secretary Betsy DeVos, she did a round of media interviews yesterday, also insisting that schools reopen. Here's a little bit of what she had to say on CNN's State of the Union.
There is nothing in the data that would suggest that kids being back in school is dangerous to them. Kids need to be in school. They need to be learning. They need to be moving ahead, and we cannot be paralyzed and not allow that or not be intent on that happening.
Now, Amy Court, DeVos just said there that there's nothing in the data to suggest that kids being back in school would put those children at greater risk. A lot of health experts would contest that. What is your response?
I'm not saying it's zero risk. Nothing is zero risk. But I'm saying that the American Academy of Pediatrics said that we need to start with the goal of having kids physically present in schools. And in fact, Friday, the American Academy of Pediatrics put out a statement together with the American Federation of Teachers and the National Education Association and the School Superintendents Association, saying that health experts should tell us when the best time is to open school buildings, and then school administrators and educators should tell us how we should do that. And the Illinois Department of Public Health, together with the Illinois State Board of Education, has said that schools can reopen, and they've issued guidelines to show us how to do it as safely as possible. And I think that we should listen to these health experts.
Stacey Davis Gates, how much communication has there been between Chicago Public Schools and the CTU regarding the reopening plan that the mayor said last week they would be releasing or announcing sometime soon?
So a couple of things, Brandis. I think that in phase 4, Illinois told us that we would have contact tracing, that we would have more testing availability in our state. We know that contact tracing is not at the level in which it needs to be in the state of Illinois, Cook County, or in Chicago. So phase 4 is falling short, right? Number 2, when I talk about mitigating risk, I want to be very clear with what that means. We can't mitigate risk, because when we mitigate risk, we harm people within mitigating risk. Chicago Public Schools is 90% students of color, Latinx children, and Black children. We know nationally that COVID has impacted both of those demographics the most. So when we're talking about going back to school, we're talking about going back to school with students who have suffered an intense amount of trauma, whose parents are facing eviction, where unemployment benefits are going to run out. So when we speak about reopening schools, to do so without the acknowledgement of 90% of our students who are encountering some of the worst circumstances that our country has lived through is dangerous. That being said, no, Chicago Public Schools has not provided us with clarity of purpose in terms of reopening our schools. We know also that many of our charters are going to go back to school in August. There has been zero clarity of purpose in many of those employers as well. Listen, Chicago is Black, Chicago is brown. Our public school system should conform to the needs of those students. And so if we agree that we need to have schools open because they are the last social safety nets in many of our communities, we also agree that we need to rebuild the social safety net so we're not completely dependent upon our school communities to provide a service that government has failed to do and corporations has failed to do as well.
Amy Court, the Illinois Policy Institute's position is that schools across the state should fully reopen this fall. In a report published just today, you write, quote, all policies must be subject to cost-benefit analysis. Given what's known about the COVID-19 virus, as well as the detrimental effects of school closures, the calculation weighs heavily in favor of full-time in-person instruction for the vast majority of Illinois children. We've got, I guess, about a minute left. Amy, what can schools do, first of all, to how do you propose making sure that they maintain social distancing to prevent the spread? And also, young children, they're not that good at staying apart from each other and at keeping masks on because teachers ask them to. What do you say?
That's true. I have 3 kids. I know how young kids can resist instructions like that. But I also have a lot of faith that teachers are incredibly creative about finding ways to get kids to do things they don't want to do, like keep their hands to themselves and not talk when other people are talking. So I think that teachers will be able to help them understand social distancing and keeping their masks on. And I think, too, that it's important to note, we also do need to make provisions for kids in high-risk categories. Many kids who are immunocompromised or who live with perhaps an elderly grandparent with diabetes or something like that should maybe not be in schools. And we can provide remote instruction for them to keep them safe. But I think that the Illinois Department of Public Health guidelines should be followed. And I think that online instruction has just proved too detrimental to too many kids, including many minority kids and many low-income kids. They're suffering the most from school closures.
Okay, and we'll have to leave it there. A lot more on this to come, I'm sure. We'll be talking about it in the coming days. My thanks to Amy Court and Stacey Davis Gates. Thanks to you both.
Thank you.
Still to come on Chicago Tonight. The 1995 heat wave's effect on Chicago's emergency preparedness. What have we learned? Renewed pressure for professional sports teams across the country to reevaluate their names and mascots. An army of Chicagoans armed with 3D printers deliver thousands of life-saving PPEs. The story behind conservation efforts to bring bison back to Illinois, plus where you can find them. And we'll take you on a private tour of a gallery filled with spiritual artwork. But first, we talked about what Chicago organizations are doing to spread the word about the census. But how have things been going so far? And why is this census different from others? Amanda Vinicky is back now with some answers. Amanda.
Brandis, community organizers never stopped, even during the height of the stay-at-home order, from trying to drive up turnout for the census. I earlier this spring met a pair of women trying to encourage residents on the west side to fill out those forms.
And make sure that if you don't do anything else for you and your community, please take the time and complete that 2020 census. And it's very, very important. And this is how you speak and get your word across.
Well, the city's response rate is at about 55% in certain census tracts. Today, Mayor Lori Lightfoot bemoaned that it's lower, around 40%, particularly in areas on the south and west sides. Now, that is true, but Kareem Butler of the Chicago Urban League says that's not the full picture.
There are definitely those census tracts that are honestly doing pretty well, in some cases above average. And these are still communities that are predominantly Black or predominantly Hispanic, and their participation rates they can be a little bit more complex than I think the conversation would indicate.
So where are responses the highest? In Illinois, 3 communities are edging toward 90% response rates, and that is Trout Valley, Timber Lane near Rockford, Hudson in McLean County in central Illinois. Now, mind you, Trout Valley in McHenry County has a village population under 600 people, so it's not as hard an ask as getting everyone in the city of Chicago to fill out a form. The lowest response rate so far hover around 20% returns in Illinois. That's Hamburg, which is in the western part of the state. Also, Muddy and Rosa Claire. These are villages in southern Illinois. Meanwhile, statewide, Illinois is coming in at number 7 in the nation, while top 3, some of our neighbors there, Wisconsin, Michigan, Minnesota. This year's census is different for reasons beyond that you can complete it online. For the first time, a question includes an option for identifying household members as same-sex spouse or same-sex unmarried couple. It's not all that activists for the LGBTQ movement had wanted, but it is a good start, says Equality Illinois' CEO.
But we are at least hopeful that we will get good data on the number of people in same-sex relationships, and that's an important first step to affirming and acknowledging who we are as a community.
So here's the option on the form. It does list only male and female as options for sexual identity, and there is no place to include sexual orientation beyond as part of a couple.
We will not be counted as members of the LGBTQ community if we're not in a relationship. We will not be counted as members of the LGBTQ community if we do not fit into the simple binaries of male or female. And that needs to change. We do need to make sure we are counting the full spectrum of our community in future censuses.
Now, a reminder, the deadline for getting that census form in, October 31st. Brandis, back to you.
Amanda, thank you. And up next, parallels between Chicago's deadly heat wave and the coronavirus pandemic.
Don't ever miss Chicago Tonight. Subscribe to our podcast. Get a daily download of our show delivered to your desktop or mobile device. Go to WTTW.com/Chicago Tonight Podcast and subscribe.
25 years ago, one of the deadliest events in Chicago history slowly unfolded. Hundreds of Chicagoans, most of them poor and elderly, died over 5 days of intense and unrelenting heat. Here's Phil Ponce reporting for Chicago Tonight on then Mayor Richard M. Daley's skepticism about the number of deaths due to the heat.
At this point, the number of heat-related deaths could exceed 500. a figure which has evoked strong reaction from Mayor Daley.
You cannot claim everyone that has died in the last 8 or 9 days or continually die of heat.
And joining us to look back at the deadly heat wave is Eric Kleinenberg, author of the 2002 book Heat Wave, A Social Autopsy of Disaster in Chicago. He's also the Helen Gould Shepard Professor of Social Science and Director of the Institute for Public Knowledge at New York University. Eric Kleinenberg, thank you so much for joining us.
Happy to be here.
So let's go back to 1995. How hot was it and what was the city like at the time?
Well, this was not ordinary heat. Although it is the kind of heat that Chicago is going to see more often. It hit 106 degrees. The heat index felt like 126. And what was really distinctive about that week is that it didn't get cool at night. It stayed up in the 80s. And so there's really nowhere for people in Chicago to turn for relief, especially because the power went out and hundreds of thousands of homes couldn't even turn on the AC.
Now, Chicago's had, plenty of hot summers, obviously. What was it about this wave that made it so deadly?
Well, it was unusually hot, and, meteorologists can distinguish between typical heat and really deadly heat. Unfortunately, with climate change, what's going to happen is we'll get more systems like the one in 1995, heat, humidity, a kind of lingering heat, so more intense and longer lasting. The one in 1995 just shocked everyone because we were used to things that were just lighter.
So who were the people, the groups of people who died?
Well, unfortunately, this was a disaster like the coronavirus pandemic we're living through right now that targeted the most vulnerable people in the city. African Americans were the most likely to die. The neighborhoods on the south side and the west side were hit disproportionately. Especially neighborhoods that were really depleted, places that had lost a lot of the population and the commercial infrastructure, where people kind of hunkered down at home rather than going out into public places to get support. One of the real big puzzles of the week was that Latinos in Chicago were much less likely to die than many experts predicted. Then in 1995, living in multi-generational households and having a lot of density was protective. Of course, this year in the coronavirus pandemic, living in a multi-generational household puts you at greater risk. So you really have to understand the sociology of these events to understand what's going to happen.
And I want to come back to that parallel in just a second. But earlier we heard Mayor Daley expressing some skepticism as to how many of the deaths were actually due to the heat. How did that impact the city's response?
Well, think about what's happened this year in the United States with the president expressing skepticism about COVID. When you get leadership doing that, it means that the government does not put its foot to the pedal. And that's exactly what happened. The city did not declare an emergency until it was far too late. They did not call in extra personnel. In fact, the mayor, the health commissioner, the fire commissioner, which runs the paramedics, were on vacation. And we treated it like an ordinary heat wave until it was too late. The medical examiner, Evan Donahue, got into a real fight with the mayor over whether the deaths were really real. You heard the mayor there expressing skepticism about the whole thing. And that meant that the Chicago government was sending the wrong message at the policy level and also to people.
You've touched on some of them just now, but what other parallels do you see between the current pandemic, COVID-19, and the 1995 heat wave?
There's so many. I mean, first, you could see the heat coming in advance. Scientists were warning that it was going to be dangerous. The leadership in Chicago didn't take it seriously. Second, when it became a deadly and dangerous situation, the leadership tended to focus on managing the public relations problem rather than dealing with it as an urgent public health crisis. I mean, they didn't call in extra personnel. Half the hospitals in Chicago were on bypass, which meant they couldn't take more patients into the emergency wards. And we clearly just weren't telling people, here's how you stay safe, take this very seriously, protect each other. And basically what happened in the absence of leadership, the city broke down just as it's happening right now in the United States. In the absence of good leadership, our nation is failing to deal with this COVID-19 crisis. And then I should say one big thing, the demographics of who is at risk. And sadly, Chicago is a city that's got so much racial inequality and so much segregation. A lot of the city just doesn't see how bad it is in other places. I think a lot of the COVID disaster has been invisible to Chicago, just as the heat wave was invisible to white Chicago.
The city did make some changes after the heat wave. What were some of them?
Well, the city is now a leader when it comes to dealing with an acute heat emergency. The city does really well when the heat comes around. It communicates more effectively. It works with local media. It sends people out to do outreach. That's terrific. It's the underlying stuff that's really difficult for Chicago. How is the city going to deal with the profound economic inequality, the racial segregation, the social isolation, and what's it going to do when those things blend with climate change or a coronavirus pandemic? We're seeing that you can't get out of these health problems just by dealing with an acute problem in the moment of the emergency. You have to plan in advance, and you have to take the underlying structure of the city seriously.
Eric Kleinenberg, thank you so much for joining us.
Thank you. Stay safe this summer.
And some of the archive video from this discussion came from a documentary based on Kleinenberg's book about the 1995 heat wave. It's called Cooked: Survival by Zip Code, and it airs tonight at 10 on WTTW. There's more Chicago Tonight ahead, but first, a look at the weather. After 87 years, Washington, D.C.'s NFL team announces it will drop the controversial Redskins name and logo. Today's move comes after renewed criticism by Native Americans and activists who've long called the name a racial slur. Joining us with her perspective is Heather Miller, Executive Director of the American Indian Center, a cultural nonprofit. Heather, thank you for joining us.
Absolutely. Thanks for having me tonight.
So what then is your response to Washington's football team, DC's football team, announcing that they'll retire the name?
Well, it's actually mixed emotions today. Of course, I'm so excited to see them make this change that is really long overdue. It is a racial slur, so removing that language from their name, removing that image from their name is fantastic. But at the same time, nothing has been posted from the team about what next steps look like. So still last week in the statement that Dan Snyder issued, he said they still want to honor their Native American commitment, and they still want to honor their history with the military. So that has me a little cautious, because I don't want to see them revert into something that's still offensive when it comes to describing Native Americans and what that looks like. So I'm cautiously optimistic, I guess, today.
Well, and this isn't the only professional team that has a name, derived from the Native American community. In baseball, for example, the Cleveland Indians, they've received some criticism for their mascot, Chief Wahoo. Here in Chicago, the Blackhawks NHL team is another example. To you, are these all equally offensive, or are some names more permissible?
They're all terrible. The way that I like to describe this is that we're talking about the issue of race-based mascots. So we're looking at using the image of people as a way to create a stereotype or a caricature or an image that is designed to exude feelings. So in that sense, it's really inappropriate to use a culture or a group of people in order to signify that. So it's very hard for me to say that one level of racism is less racist than another. So I don't see any difference in between in having a name like the Washington team versus the Blackhawks here in Chicago. It's all about that erasure of actual Native culture and the appropriation of actually taking it from us and creating it into what someone else wanted it to be.
And the Chicago Right, and the Chicago Blackhawks, they haven't returned our request for comment, but in a statement released by the team last week, they said, quote, "We recognize there is a fine line between respect and disrespect, and we commend other teams for their willingness to engage in that conversation. Moving forward," it goes on to say, "we are committed to raising the bar even higher to expand awareness of Black Hawk and the important contributions of all Native American people." What's your response to their argument and to the city's NHL team?
I just laugh. That's such a fake statement. I mean, if they really cared about educating the community as they say they would, then Chicago would look way different than what it does right now. Think about how much money that team actually brings in. Think about how much players are making. Think about how much their executives are making. That's a lot of money. The team could absolutely give money to Chicago Public Schools to create curriculum around the tribe. They could easily give money to Native curriculum writers to create curriculum that would tell the story of Black Hawk and his tribe, but they don't do that. You don't see education happening at the games. You don't see information being passed out to fans about who Black Hawk was. You don't see any of that. Occasionally they'll bring folks onto the ice to, show off their regalia and stuff, but that's not education. That's not creating an environment where people are learning about our history and about our culture. And so their statement just falls on deaf ears because they're not actually doing anything to provide education.
And what about the fans? You know, a team can change a name or not change a name, but the fans can still do what they want. What do they need to know?
Yeah, that's the problem. The fans can absolutely do what they want. So the fans will continue to wear headdresses. They'll continue to do things like the Braves chop. They'll continue to paint their faces. That's still cultural appropriation. So those are the things that we don't want to see. We want to be the ones to accurately represent our culture. We want to be able to present our heritage. And so having a group of people that is not us do that is the issue. I mean, I want to celebrate this great hockey team that we have here, but I don't feel comfortable going to their games because of the mascot and what I see from fans in the arena. And so there's still a ton of work that needs to go into this process. And I still think that the team is being really flippant in terms of its reaction and what it really needs to do in order to think about not being a racist organization.
Okay, I'm sure more to come on that. We'll hope to have you back as this discussion continues. Heather Miller, thank you so much for joining us.
Absolutely, thank you.
The CDC recommends face shields for healthcare workers testing for COVID-19 or treating COVID patients. But while access to some personal protective gear has improved, face shields are often in short supply. A group of volunteers in the Chicago area have made a serious dent in that shortage, though. And as Jay Shefsky found out, they were inspired by Chicago Tonight. Jay first brought us this story in May, and they're still at it. So here's another look.
This is a 3D printer. It's making a face shield. So is this one, and this one. In homes throughout the western suburbs, people are using their 3D printers to make a lot of face shields for healthcare workers. They're not the first to do this, but the scale and organization of this project is what makes it remarkable.
The whole thing started when I was listening to a piece on Chicago Tonight.
The operation is run by Oak Park residents Rob and Susan Parks. The Chicago Tonight story was about an engineer making face shields for a hospital.
And it posted the necessary files on the WTTW website. I got the files, and in about 3 hours, I made a headset frame. Susan had some page protector material.
The 3D printers just make the headset. The shield is a standard heavy-duty page protector. Now, it so happens that Rob and Susan have a neighbor who is an ICU nurse at Gottlieb Hospital. She was worried about PPE supplies when Rob showed her the prototype back in March. She showed it to her bosses.
The intensivist and the manager together said immediately, order 72, basically all the nurses and the intensivists, some of the respiratory therapists.
That threw me into a bit of a panic, actually, because it took me 3 hours to print that first one.
Rob and Susan used an email list for local school parents to put out a call for people with 3D printers.
And inside of a day, I had 20 people signed up to print.
Rob dubbed them the Noble Army. After they delivered that first order, they easily found other institutions that needed face shields. Soon, there were 40 people cranking out more than 200 face shield frames a day. That kind of volume requires a lot of organization. Rob and Susan both have business backgrounds, and their home has become the hub of this socially distant factory. The makers deliver new frames to this basket on Rob and Susan's porch.
Sometimes we get 300 in a day, and we have to disinfect them. We dry them. We 3-hole punch the transparencies for them. This was 14 for a nursing home. And it includes the frames, it includes the transparencies, and it includes all the instructions that they need.
As of today, the Noble Army has delivered nearly 8,000 face shields for free to more than 125 institutions throughout the Chicago area. The cost per unit is about $1, they say. The materials have been partially covered by donations, and all the labor is donated.
So there's obviously a really hidden but very powerful force in the community that was like waiting to be tapped. All these people, they want to find a way to help. I haven't met a lot of them face to face, but I love these people.
Now, Rob and Susan have made the entire operation easy to replicate anywhere in the world. They've created a website with everything you need.
What we're looking to do is to have your viewers ask themselves, who do I know in another city who might want to partake in an activity like this that would benefit their local community?
I will be glad when what we do is not necessary anymore, because that means people will not need the type of protection. But while it's there, we will fill the need.
And given the number of their face shields that are now in use, there is a very good chance that the Noble Army has saved lives. For Chicago Tonight, this is Jay Shefsky.
And the Noble Army is still going strong and making face shields. If you know someone who might want to start up their own similar operation, you can go to our website and share this video with them. You'll also find a link to the Noble Army's website, which has everything needed to get another army up and running. Up next, where the buffalo roam in Illinois.
This evening's presentation of Chicago Tonight is made possible in part by ComEd, powering lives.
We have a tremendous source of untapped, efficient energy right here in our school. Let her rip, Jenny.
I kind of love this idea.
The ComEd Energy Efficiency Program has real ideas for making schools energy efficient.
Pedal faster.
Judging the best garden in Chicago's Bungalow Belt and bison roaming in some Illinois parks. Joining us with more details and a roundup of her stories is WTTW News reporter Patty Wetley. Hey, Patty.
Hey, Brandis.
Okay, so the Chicago Bungalow Association is holding its 4th annual garden contest. What exactly is being judged in this contest?
Well, it's important to know that we, the people, have the say. So popular vote will carry the day. There are 3 categories that people can vote in. The Bungalow Association has narrowed it down to 10 finalists. For front garden is one category, rear or side garden is another, and then window/planter boxes is a 3rd category. So, these run the gamut. They can be pollinator gardens. Some people have chickens in their backyard and have done like lots of raised beds. Others are showing the different textures and shades of greens that you can do. So, you know, have at it. Everybody gets one vote per category. So not exactly the Chicago way of voting. You don't get to vote often. But
vote early, vote often.
Vote early because it ends July 15th.
July 15th. All right, before we run out of time, another one of your stories focuses on National Bison Month. What is significant about that animal here in Illinois?
Well, it's, you know, natural to our ecosystem that we had here in the prairie. The bison did used to roam here, and they've been reintroduced at a number of places outside of Chicago and also in Northwest Indiana, where they are part of experiments to restore the natural tallgrass prairie ecosystem. So you do not have to go to Yellowstone or South Dakota to see bison. You can see them here in Illinois and Northwest Indiana.
Where in Illinois can you see them?
So I'm going to hopefully pronounce this right, Medewin, which is kind of in the Joliet area, the Nachusa grassland, which is about 100 miles straight east, and then Kankakee Sands, which is in Northwest Indiana. They all have herd roaming like 1,000 acres a piece, and hopefully you can catch a glimpse of them.
Okay, and so let's clear up this little bit of confusion.
Yes.
Buffalo or bison, they're not necessarily, it's not accurate to use them interchangeably.
Correct, and it's bison, bison, bison. It's the bison in America, that's all it is. It's the bison species, like literally that's its name. Buffalo, not correct. You can say American buffalo if you absolutely have to, but bison is the way to go.
That is going to be tricky to get a lot of folks to practice.
I know.
Using the name correctly, but we're going to start it right here and right now, Patty Wetley. Thank you so much for joining us.
Thanks, Brandis.
And you can read Patty's full story on National Bison Month and find more details about the Chicago Bungalow Association's 4th annual garden contest on our website. That's at WTTW.com/news. Chicago Tonight got a private tour of a collection of artistic treasures with a spiritual focus. We brought you this virtual visit of artwork designed to inspire back in May. Here's arts producer Mark Vitale with another look.
There is artwork from Russia, and a painting from Peru blends Christian beliefs with Incan motifs. But European works are the foundation of the Darcy Collection, a treasure of medieval, Renaissance, and Baroque art. This assemblage of art occupies 3 galleries at LUMA, the Loyola University Museum of Art on Michigan Avenue.
So we're definitely focused on art illuminating the spirit, and I think that comes through our name, LUMA. And we want to provide a space for artistic expression that illuminates the experiences of humanity and the spirit. Something that comes up a lot when I talk to my colleagues at Loyola is that art has the power to transform society. And I think a lot of that is connected to the spirit.
There is an abundance of 3-dimensional work, sculpture, and religious objects. The collection was founded in 1969 by a Loyola priest, Father Donald Rowe.
Once it started to get more popular and the word got out through the curator and the university themselves have had donations and acquired more pieces to supplement the collection.
It also includes secular works that celebrate family milestones such as weddings and births.
It's beyond seeing a painting or a sculpture of Jesus Christ. It's also about the way of life that people were living at the time and how their lives were kind of greatly integrated with their spirituality, something that we may not see as often today, but is still quite relevant.
Also on view, the struggle for spirituality. Here, the prophet Job fights his demons. This 500-year-old crucifixion scene from the Netherlands paints a grim picture of the horrors of execution. This curious elephant clock represents Christ trampling the devil. It was recently on loan to the Metropolitan Museum of Art in New York City.
We have a lot of people that come through for a specific event called the Visio Divina.
That means sacred seeing,
where students from the theology department come through and sit with the art and kind of have a meditative experience. And I think, especially during a time in the pandemic, it's just a time to be quiet and reflect on the human experience and society's experience. Even if somebody grows up differently or has a different religion, we're all connected by the idea of answering to a higher power, whatever it may be, and how it kind of grounds us.
For Chicago Tonight, this is Mark Vitale.
When the Darcy Collection at Luma reopens to visitors, it will be by appointment only. You can see more of it on our website. And tomorrow, we visit one of the first museums to reopen its doors. And that's our show for this Monday night. Don't forget to stay connected with us by signing up for our daily briefing. And you can get Chicago Tonight streamed on Facebook, YouTube, and our website, WTTW.com/news. You can also get the show via podcast and the PBS video app. And please join us tomorrow night live at 7. The latest on a debate that's roiled Chicago over the past month. Do police officers belong in schools? And one of the first Chicago museums to reopen focuses on a show about resistance. Now, for all of us here at Chicago Tonight, I'm Brandis Friedman. Stay safe and healthy, and have a good night.
Closed captioning is made possible by Robert A. Clifford and Clifford Law Offices, a Chicago personal injury and wrongful death firm whose pro bono work kept open a church shelter for the homeless in Chicago's southern suburbs.